So this fourth video is very important. I think it's the most important of them all because this is where clients have issues with doctors or nurses or even the clinic. And it's important I make this video because communication, understanding, education is important. In this video, I'm talking about not trying to scare you, but we need to discuss about it. It's about the failures, the risks, the complications that can occur when going for IVF. I understand that couples are coming from a place of high expectation, a lot of pressures around, and they are looking at IVF as the last hope to get pregnant. But at the same time, when taking risks, you have to accept the fact that there may be failures. And not just accepting that fact that there may be failures, but also having plans to either prevent the failures or managing yourself if the failure occurs. So what are the failures, the risks, complications of IVF? So I'll start by saying that when the IVF process starts, you could be stimulated with some injections to multiply follicles in your ovary. And number one, you may not respond. That's one failure. It could occur. Even if you have a good AMH, it can occur. Be aware of that. Or probably you respond well. And on the day of the egg collection, they suck out the follicles. Remember, the follicle is a sac that contains the egg. So they suck out the follicles and no egg is seen in the follicle. It can occur even if you have a good AMH. Another thing that can happen is you respond well to the stimulation. They got eggs from you. The eggs gotten might not be mature. Despite taking your HCG injection and following all protocols, it might occur. Not every time, but probably 30% chance. Okay, fine. You get eggs, you get matured eggs, and they inject the sperm into the matured eggs. And after 24 hours, you may be told that the baby was not formed. Most times it's due to the sperm having issues. So the fertilization might not occur at all. Let me pause. I'm not scaring you. I'm not scaring you. I'm just telling you these things because after this, I'll not tell you what should be done if this arises. That's why planning for IVF is very important. Also, other failures that could occur is there's fertilization. The embryos are formed. They keep on growing, but before the 5th day, they get arrested. They stop growing. They are not viable. That means we can't transfer an embryo. Sometimes we could transfer the embryo on the day 3, hoping that the womb would accommodate the embryo to grow properly. Other failures that can occur is on the day of transfer, the embryos may be of poor quality, maybe grade D, 1D, 1A, C, or 1B, C. It might be a poor grade. And sometimes we leave it for the couple to decide if they want to go ahead, but it shows that the outcome might be low. The success rate. The most common failure that occurs in IVF is that you might surpass all these hurdles. But you transfer the embryo and you're going to come back in 2 weeks' time for a pregnancy test. In fact, you do the test yourself. They will give you an urine pregnancy strip to check for pregnancy after 2 weeks of transferring the embryos, and we hope it comes out positive. But this is the most common failure. It might come out negative because we don't understand why the embryo that was good after observation did not implant in the womb. And lastly, the embryos might implant, you test positive, you all celebrate, and you're told to come back for a 2-week scan to confirm the location, the viability, the number of the embryos. And for some couples, unfortunately, they scan them and no sac is seen in the womb. Or probably the sac is seen, but the baby is not growing fine. Or probably they transfer one embryo, you are seeing 3 embryos, or you're saying 4 embryos. They are good news, but at the same time, it's a risk to the mother and the child because multiple pregnancies can lead to miscarriage. In IVF, miscarriage can occur. I mean, IVF pregnancies, miscarriage can occur, ectopic pregnancy can occur, ovarian torsion can occur. Before I conclude, during the egg collection, complications can arise, but they are very, very, very rare because we observe strict preventive protocols. We could have what we call bleeding, mild bleeding, we could have infection, we could have an injury to organs, but all these things are rare. They rarely occur because we cherish health than eggs. So that's that for the egg collection. These are the things and other things that you would read in the consent form. It's important you read the IVF consent form. I know it's kind of bulky, but you have to read it because knowledge is power. Read it. If you're not clear about something, then you ask the doctor. One of the most common complications in IVF, especially during stimulation, is what they call ovarian hyperstimulation syndrome, OHSS. It's a condition whereby the ovaries are swollen, the tummy is swollen, the woman experiences nausea and vomiting, she feels sick. This occurs because of the way the ovaries have been responding to the stimulation. It's not a cause of alarm because we observe strict preventive policies to prevent it. And even if it occurs, you call the nurse and you'll be observed for a few days. The swelling will last for a maximum of 5 days and it will reduce. So don't be worried about it. And in the event whereby you are diagnosed of OHSS, it means that your health is more important. So therefore, we may not transfer your embryos at the right time because if you're pregnant, the condition can get worse. So we normally freeze your embryos, then you come back in your next cycle and we transfer the embryos.